trying to get the mics working. Here we go.
Any night classes or day?
Good evening, everyone. Welcome to this regularly scheduled meeting of the Board of Education. Tonight is Tuesday, January 11th, 2022. We're in the Town Hall chambers. Ellen, can we have a roll call, please?
Yes, Chairman Carey. Good evening, everyone, and Happy New Year. Mrs. DeRoberts?
Here.
Mrs. Drew?
Here.
Mr. Healy?
Here.
Mrs. Granato?
Present.
Mr. Lacavoli?
Here.
Dr. Regan Lefebvre?
Here.
Mr. Riley?
Here.
Mr. Cassio?
I am here.
And Chairperson, Mr. Carey?
Here.
And Wethersfield High School Student Representative, Lena Usello? No? All present.
Thank you so much, Ellen. If we could rise for the Pledge of Allegiance and have Ms. Dio Markopoulos lead us. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Mr. Emmett, student staff recognition.
We have none this evening, Mr. Carey. I will tell you, we're looking forward to later in the month at our meeting on January 25th of having our friends from Highcrest come for a presentation.
Thank you. Moving on to approval of minutes of previous meetings. Do we have a motion to approve the December 14th, 2021 regularly scheduled meeting of the Board of Education?
So moved.
Do we have a, thank you. Any comments, corrections? Seeing none with a motion and a second, all in favor say aye.
Aye.
Opposed? Abstentions? Motion carries. Do we have a motion to approve the December 20th, 2021 special board meeting of the Special Board of Education meeting?
I move to approve that meeting minutes.
I'll second.
Thank you. We have a motion and a second. Any comments? Corrections? Seeing none, all in favor say aye.
Aye.
Opposed? Abstentions?
Abstain.
Thank you.
So noted.
Motion carries. Public comment? Seeing nobody from the public, moving on. Communications, Mr. Emmett.
Thank you, Mr. Carey. Good evening, everyone, and a happy 2022. Obviously, we have seen over the past month a significant rise in the number of positive COVID cases. We saw that trend happening prior to the holiday, and the holiday break was no break from the number of cases that we had. So I will say that over the course of the break, we spent a lot of time on the EOC team. As you know, the governor announced that he would be distributing COVID test kits along with masks to municipalities. I am very pleased and proud to have been part of the EOC in the distribution of both masks and COVID kits. One of the things that I've always loved about this town is how everybody rallies together, everybody works as a team. And what we saw over the past couple of weeks was nothing short of that. And just to put it in perspective, we had EOC meetings during the break on Tuesday, on Wednesday, on Thursday, and then there was even an emergency meeting on Sunday, January 2nd. And we had to do a lot of kind of thinking on the fly because the guidance changed continuously. Yes, we were getting the kits. No, we weren't. Then they were delayed. So we were able to utilize Wethersfield High School as a distribution location. We had two distribution dates of January 3rd, Monday, where the district was closed in observance of New Year's Day. So we took advantage of that and handed out, I want to say, between 1,100 and 1,300 kits. And then again, this past Saturday, we got another shipment at the town, and the town was able to distribute another 1,700 masks. We saw 850 cars go through the high school campus in the span of about an hour and a half. That is amazing efficiency. So again, I could not have been more proud to have been part of the process. The number of volunteers that came out to help give out kits and masks was huge, and again, I think it was handled very, very well. Again, kudos to the police department, Anthony Dignati, who's the director of the EOC, Town manager, interim town manager Bonnie Therian, Rich Bailey with Public Works, Sally Katz, Erica Teixeira. We had police cadets, we had volunteer ambulance volunteers out giving the kits out as well. So it was really a concerted effort, and was very pleased to get these kits out into the town. From the school district perspective, again, the same situation held true when it came to getting all of the kits in and the masks in. So let me put that into perspective. On Monday, the 3rd of January, I received from the EOC just shy of 2,900 N95 masks. And on Tuesday morning, at actually probably about 7:30, I know Mr. Kazaka was one of the first ones in. We took over the lower level of the Stillman building, and we distributed all of those masks to staff. They were out in schools by 9:30 a.m. on Tuesday morning. And again, Trent Donahue was there, Mike Barabalt, John Kazar was there to help out, and many of our Stillman team that dropped what they were doing to make sure that these got sorted and got out to schools. With regard to kits, testing kits for staff and for students, I got notification that we would receive a shipment of those kits on Monday the 3rd. By Tuesday afternoon, Fire Marshal Dignati had gone over on our behalf to the distribution center in New Britain for Region 3 and picked up our kits for us. So we got those later Tuesday afternoon. By Wednesday morning, Mike Barabalt had the staff kits distributed out to nurses at all of our schools, and by Thursday morning, the student kits were distributed out to schools, and they are in the hands of our nurses now. So we have done yeoman's work of responding to the need at this point in time. So I can tell you, if I have a symptomatic staff member or I have a symptomatic student, we have kits available to give directly to families. I do want to say, I had a couple of parents question late last week about the issue of, well, why can't nurses administer the tests? Our nurses need to be CLIA certified, and our nurses are not. They do not have that level of certification. So they are unable to administer a COVID test to students. But again, as parents come to pick students up, we will provide the kit. The kit has directions in it, and parents can then administer that and determine whether or not we have a positive case. So again, a lot of changes with guidelines this evening, as has been the case over the past couple months. We do have a brief presentation. We'll have Mr. Barabalt come up, and we'll talk about numbers, where we're at right now, and how we're responding. So couple of other items, just so that you're aware. We are getting ready to dig deep into budget season. So this evening, we had a Finance and Operations Committee meeting. We've set 3 dates for upcoming budget workshops. I am quite certain that Chairperson Drew will speak to that this evening. Also want to let everybody know that our winter sports are in full swing. We certainly have been impacted by COVID, no doubt about it, but all of our winter sports are currently operating and are well on their way into their season. So at this point in time, that's communications, and look forward to doing the presentation on COVID.
Thank you, Mr. Emmett. Moving on to action items, there are no action items. Moving on to reports and discussion items. Mr. Emmett,
Yes, sir.
COVID-19 update.
Yes, sir. Let's dig right into it as Mr. Barabalt comes up to the podium. So just from a town perspective at this point in time, as of the 6th of January, Wethersfield is still in a red alert level. We, as of last week, had 167.5 cases per 100,000. That is the highest that I have seen it throughout the course of the pandemic. And to put that into perspective, that's a rolling average of 2 weeks. So week 1, we had 196 cases in Wethersfield. Week 2, which would have taken us through New Year's Day, we went from 196 cases to 414 cases reported in Wethersfield. So we've definitely seen an uptick. From a perspective of total number of cases, as of the 6th of January, Wethersfield is currently reporting 4,119 total cases. The number of deaths remains constant at 46. From a standpoint of our school district, with today's cases, we reported a total of 33 cases. That was communicated out this evening at 5:45. We currently have approximately 573 cases in the district from August 30th through today. Now, putting that in perspective, last year, I reported a total of 332 cases from the beginning of the year to the end of the year. So we have definitely seen a large increase in the number of positive cases this year. I will also say our data continues to tell us that the bulk of these positive cases are among those who are vaccinated. That is specifically within the student realm. We've seen more of an equal split.
Did you mean vaccinated or unvaccinated?
The majority of the student cases we've seen are unvaccinated. Sorry if I didn't get that right. With regard to staff cases, we've seen more of a kind of an equal mix of vaccinated and unvaccinated. So I will say also that obviously over the course of the break, people traveled, people got together with families. We saw a lot of family spread as we came off the break, and that has certainly had an impact. We've seen a lot of siblings, positive as well. One of the things we've done with the advent of the kits coming in, so a student that comes in to a nurse's office that is symptomatic, I will tell you that student is going home. That is our plan, that's our response. If a student has symptoms, they're going home, we're going to send you home with a test kit so your parent can test. And that, we feel, is a good way to be able to identify students that may be positive. Again, we're also looking in classrooms to see if we have spread within classrooms. We're looking at one elementary classroom right now where we've seen multiple cases in a grade 4. What is our response? We send home kits to all of the students in that class. So everybody gets the test, and we can identify if there's anybody else that may be, in fact, positive. So, again, from the perspective of the guidelines, they have changed a little bit. I'd like Mr. Barabal to talk a little bit about that and how that's impacted us here in Wethersfield.
Yeah, so we, excuse me, we have implemented what the State Department of Health and Department of Education has put out. We are now a 5-day quarantine with a return on day 6. That child or staff can return on day 6 without fever or no symptoms, or symptoms dramatically improving, as they say. So what that's done is shorten our quarantine times for kids getting back into school quicker. It's also allowed our staff, when we do have cases go out, we've actually had staff coming back. So we're not feeling the huge impact of staff being out 10 days, multiple staff, especially with the infectious nature of this where we have multiple people out. It's allowed us to get our teachers and our kids back into school at a quicker level. Now, we have had some children and some parents call the schools and talk to our nurses and say, hey, listen, my child, it's day number 6 is tomorrow, but they're still coughing very much, they have a fever. So the nurses are great, and we extend that quarantine until they meet the criteria to come back. So not every child comes back on day 6, but we're having a good response with non-symptomatic kids coming back into the school, reacclimating, and not having any spread from that. So we did have that one situation at the elementary school where we did send kids home to the children in there because we had multiple kids in one classroom. We're waiting results on that, and if we find that there are, we'll take the appropriate action. They'll obviously stay out, and we'll go from there. But that's the only instance we've had of this. It's been successful. It's been well received at all the schools. I think most parents are good with it too because it gets their children back into school, unfortunately, if they do get it with such widespread. And also, our nurses are doing a great job of managing it and bringing the kids in, evaluating them to say, what are your symptoms? These are COVID symptoms. You have to go home. Here's a test afforded to the family so we can get some answers, and we get some answers right away. So I think it's a very good program.
So from a perspective of contact tracing now, the contact tracing has changed, and it had become extraordinarily cumbersome for nurses to try and figure out, who was in close contact. Right. Have you seen a difference, Mike, with regard to how we've responded now that contact tracing mandate?
Absolutely, Mr. With the rates that we were having, our nurses, admin teams, and myself and people that go out to help with the contact tracing, it was literally a start of school day to the end of the day routine after the school day, trying to follow who was being a close contact, where were they, especially at the upper levels when they move around to different classes. So it was a constant daily event where you could get nothing else done. What this allows us to do is say, At the elementary levels, if we have a case in a class, the mandates say that the principal has to notify that class that there was a positive case in your classroom, monitor your children, and to give them the guidance on what to do. At the secondary level, at the middle school, you identify that we had a positive case in whatever grade 6 or grade 7. At the high school, the requirements are we do it school-wide anyway, which Mr. Emmett does on a daily basis. They're just moving, they're more mobile. So that allows everybody to monitor themselves and be able to be responsible and know what's going on, especially if you have one in the classroom. You as a parent can say, I'm going to watch my child, and if there's any symptoms, I can request a test, or I can keep them out of school. So, but we don't have to get as granular as going in and measuring and see who is close contact, call that person, you're out for an extended period of time. That doesn't happen. Now, this does not eliminate all quarantines. It does for school-based stuff. If we learn of a close contact of a non-vaccinated child outside of school, if the parents notified us, because we are having a lot in family spread, then they will have to quarantine. And the guidelines, again, are 5 and 6, along with no fever, no symptoms, or symptoms dramatically improving. So it does cut down on their quarantine time too, but our contact tracing has freed up our nurses. They're still busy with cases. They still have to do that stuff too, but it's not an all-day event anymore. And it's allowed our administrators to get some more stuff done and have our nurses focus on the health and well-being of the children that are present and monitoring them for symptoms as well. So I think it's a win-win for everybody. Gets kids back, it frees up our staff, gets our staff back quicker too. So I think it's a good thing that we're doing, and we're going to continue to follow that.
I do want to say also that the state, and again, this is the challenge that we face when, the state will come out with something, and a lot of times the guidance comes out first, and then the explanation for the guidance comes out after the fact. That is the same case here. So this evening, when I sent out the communication via Paris Square, we had a frequently asked question sheet that was provided by the state this afternoon around the guidelines, so I did provide that to the community. And again, if parents have any questions or concerns, reach out to the school nurse first and foremost. Again, Mike Barabalt is our security director. He's also our co-liaison for the COVID response. Mike is a retired Southington police officer, and I know in the beginning of the pandemic, you were actually doing that same work for the Southington PD when we were closed.
I was.
So, Mike knows his stuff. I will say also, we lost Chloe Bobrowski. She's gone to the state. Throughout the scope of this recent surge, Chloe has continued to be a great resource to us at the state level. Reached out to her, as has Mike. We actually have interviews tomorrow for the nursing supervisor position, so I hope to get that position filled sooner rather than later. But again, I can't say enough good about our nursing staff as well. We had our PD day last Wednesday. Mike and I actually had the opportunity to chat with nurses virtually and, talk about questions and concerns they had, and then, providing the necessary supports. I do want to mention a little bit about the vaccination rate as well. I said this in each of my communications, and I continue to reiterate it. I don't mandate vaccinations for students. However, the evidence is clear. I mean, it's certainly something that we support based on the advice from health professionals. So I do want to give you the vaccination rate as of the 6th of January. So in Wethersfield, children ages 5 to 11, 28.7% are fully vaccinated. Age 12 to 17, 71.8% are fully vaccinated. Age 18 to 24, 87.1% fully vaccinated. Age 25 to 44, 88.1%. Age 45 to 64, we have 84.4% fully vaccinated. Age 65 plus, 93%. Yeah! I'm not going to respond to that, Mr. Cassio. I don't want to date you. But that's where we're at right now at this point in time. And again, I had the conversation with parents from WSPC last Thursday, and kind of was asking, how do we increase that rate? And I understand that parents feel uncomfortable with it, and I certainly don't want to push. But all I can do is report what I'm seeing, and the vast majority of our student cases continue to be among those who are unvaccinated. So definitely something to work on. One of our parents who's on the WSPC works for Hartford Healthcare and reminds everybody that Hartford Healthcare has ample supply of vaccine. It's available right at 1260 Silas Deane Highway. and you can make an appointment through MyChart Plus and get right in. So the availability is certainly there. With regard to incoming supplies at this point, I don't know of any additional supplies that are forthcoming in terms of either masks or testing kits. I did say in a communication, I think it was late last week, we got the N95 masks for staff. We did not get student masks. I don't know of any plan to provide those to students. But again, if anything changes, I will absolutely get that information out. I am certainly hopeful that, we are riding the wave right now, much like we did last year around holiday time, where we've had a lot of spread in the community. I'm hopeful that we're going to get to that peak very quickly, and then we'll start to see the numbers come down. And then finally, from a staff perspective, obviously over the course of vacation, we reported approximately 30 staff members that were positive. We definitely had challenges in terms of covering classes. Our principals did great work with being resourceful as best they could, and I think our students were really great about managing. And in some cases at the middle and high school level, class was being held in the auditorium or in the cafeteria with plans provided by the teacher. So it'll continue to be a challenge. I can tell you yesterday we had approximately 83 staff members absent, and that number was down by almost 20 today. And we've seen it on the custodial side as well. And in talking with Sally Katz, what they have found is we'll have 2 go out with COVID, and we have 2 coming back in off from COVID. So we've still been able to run the buildings, and we're doing everything we can to keep the schools open. And finally, last but not least, I just do want to let the public know, I've had a couple of parents reach out about the remote learning option. And just to remind everybody that the state at this point in time does not offer the remote learning option. And again, if things change, we'll certainly consider it. But at this point in time, we're doing our level-headed best to make sure we have our kids in person learning. They're getting everything they need. They're getting the breakfast, they're getting the lunch, they're getting the opportunity to socialize. And we think it's important that they are in school as much as they can possibly be. So with that, Mr. Barabal, any additional comments?
No, sir, I think we've covered it all.
Excellent. All right. Any questions?
Any questions or comments from the board? Yes, Mr. Cassio.
Yeah, I just have, you answered the question, but,
Sure.
regarding the routine tracing of an individual. And, we've modified it, but technically you're still doing it in a not as aggressive way.
Really, you're letting folks know, right? We're not
Correct.
going in and saying specifically, you two are close contacts, you got to go. We are letting parents know that there was a case.
Yeah.
So just be aware of it, so we are. But we're not getting down to the finite minutia of it, correct?
Okay, yeah, because, I received a communication indicating that activities would be discontinued. That came out from DPH.
Right.
And it was sent to me and circled. But I think you answered the question. We do have a system in place that we are tracing, but not as aggressive as it was in the past.
What we will do, we don't go into the classrooms exactly and do it specifically, right? But we know, and we let our parents know where there was a case, so they can assist with us and look at it and make sure that there's not any spread within that. And also additionally too, our nurses are now being able to focus on, if you do have a child that's sent down to the nurse because they're sick, the teachers are aware of it too, they're highly in tune, and our nurses are too. They're evaluating them for COVID symptoms, so what they can do now is say, okay, you have to go home, we'll get mom and dad to pick up, we're gonna give you the test. So you can go home and take that test and we can get the answers right away. So I think that enhances it instead of just saying, okay, you all have to go. If you're not symptomatic, stay and learn. Once you turn that way, our nurses, they know the symptoms, they can make that determination. So I think it's more finite that way.
And then the other question has to do with the remote learning option with regards to the district. So far we're riding the wave, but at the point when we do have an issue where their staff members are not able to get in the building and our sub-management isn't there, we don't have bus drivers to bring the kids to school, when will that be discussed on the state level? Is the state setting up our communities for failure?
That's a very good question. And, I think to an extent, that's certainly possible. And, I think it's very difficult at a local level to have to make that decision. And John, honestly, at this point in time, if I didn't have enough bus drivers and couldn't run the buses, or I didn't have enough staff, I'd be more likely to close a school until I had staff back and then just extend the days beyond. The challenge with this is that you've got a very high infection rate right now. And in the past, we've talked about, when you get to that certain threshold in red alert, you have to close and you have to pare back. Here's the other reality with the remote learning option. The remote learning option, I can offer that at school, but am I still going to have students going out to sporting activities? Am I going to cut off athletics as well? Am I cutting off extracurricular activities? And that's one of the challenges we saw with Screen and Stay. Screen and Stay was designed, and we implemented that back in early November. It was designed as a means of keeping kids in school. And what we tended to find is that Screen and Stay worked in school, but we were still seeing kids engaged in, although they'd been exposed and should have been quarantining outside of school, were engaging in sports and engaging in life and doing things that they would typically do. So it's that much more difficult now when you have all of the other extracurricular activities in place to get to the point where you can scale back. So very good question though, John.
Yeah, I just think that, that's on a lot of people's minds, so I figured that, ask it at the board meeting and figure out what it is that we're trying to accomplish. And I think it is to have the children in school, provided the school has the ability to give the children the correct day's work.
Yep.
So.
Any other questions or comments? Yes, Dr. Regan Lefebvre.
Yep, thank you very much, Chuck. First of all, let me thank you all for all that you're doing. I know behind the scenes I'm a pain in the neck, Mike, pushing you to do more, but I know how much you are doing, and I really, really appreciate that, especially, the last minute scramble over a holiday weekend to get those masks out. It was huge. But I am hearing so much from anxious parents, and there is, as John was just referring to, potentially a looming staffing crisis. We're already very short-staffed in terms of subs, and if we have more and more teachers who are out, even if they are, just being monitored, this is worrying. So we need to keep an eye on it and figure it out. Can I just get a clarification on one of the last things you said? So a student who is Screen and Stay, are they allowed to participate in Wethersfield sponsored sports, or is this kind of risky behavior happening in sporting activities outside of the school system?
With regard to Screen and Stay was designed to keep kids in school.
Yep.
So Screen and Stay was a result of an exposure that occurred in school. Now that exposure has occurred. It allows the parent the opportunity to be able to monitor, but the extracurricular activity should cease while they're being monitored. So we're continuing the school, and remember, let's face it, with the school piece, you've got the mitigation strategies in place. You've got masking, you've got the hand sanitizer, you've got the hand hygiene. You don't have that level of, mitigation strategy in the youth sports realm. So that's what becomes more of the challenge. And I think, the thing too, when we're talking about the remote learning item, yes, I can provide remote learning, but the reality here is I'm not controlling what you're doing outside, whether it's you're traveling, whether it's you're going to sports. And I think we saw that, for one, I will be the first to admit, I traveled, and I saw more people on the road this year compared to last year than ever before. So I think, people are getting to that point where they want to get back to life, but at the same time, your point is a very valid one. Parents continue to be anxious. And, the only thing I can say from our perspective with our mitigation strategies, we've talked with principals, meeting with them every week as recently as today, and just reminding them to make sure that we have product in the schools, making sure that we're socially distancing where we can. Masks are continue to be the mandate right now. And doing everything we can to make sure we have a safe environment. But, I find it challenging where I can create a very safe environment within the school, and then you're going to go out to the movies. Do you have to wear a mask when you go to the movies? It depends upon the municipality. Some municipalities, yes, you do. Others, you don't. Do you wear a mask when you go into Stop and Shop? Some do, some don't. So that creates the major challenge as well. So.
Can I just, if, I'm still not sure if I'm completely clear on this. Let's take the example of a high school student who we know has probably been exposed, and it's screen and stay. So,
I just want to make a clarification. We're
Yeah.
not doing screen and stay anymore. That's
Right,
gone.
okay.
So what we're doing now with the 5 and 6 and what the
Yep.
DPH new guidance is, we're just notifying the high school. We're
Mm-hmm.
not tracing anything really, but we're saying, we had, today, for example, we had 11 cases at the high school today. So because they're mobile and they do things like that, so now please monitor your children.
Mm-hmm.
So unless they're positive or we have a known contact, close contact outside of the school environment, then those, the 5 and 6 and the quarantines would fall into play. If not, if they're just in school and they weren't the person who tested positive, they can go about their business, even in athletics.
well, let me just say this then briefly. I would be in favor of a policy that restricted students from taking part in school-sponsored extracurriculars if they are considered to be in a period of being monitored. So what I mean is, if we know that a student's been to close contact or something,
Right.
that they should not be able to go to sports practice until they have been effectively cleared. And I'm sure that would be very unpopular. It would be awkward for teams. It would be awkward if you're the lead in the school play and you can't go to practice. But if we can't control everything in their lives, but we can control whether they participate in extracurriculars.
But we do. If they're positive and they're out that 5 days, they can't participate. And if they're in known quarantine, they can't participate.
They cannot.
No.
Okay.
Because they're not in school activities. No, there's mechanisms in place to know that they're out and they're on, and none of those, they cannot participate.
Okay, so that was my
That's been in
original
place.
question.
Yes,
Okay, so that's good.
correct. That's always been in place. Just the quarantine and the time they're away has just shrunk.
Gotcha.
It's always been in place, and that hasn't changed.
Okay,
Yeah.
thank you.
Yep.
Any other questions or comments? Yes, Mr. Riley.
I just had a comment, as parents, the other thing that we can do is ensure that our kids are fully vaccinated. So both of my oldest have gotten the booster. My youngest has had the 2 shots in December. So, that gives me some comfort that we're doing the best we can for them.
Absolutely.
Thank you. Anyone else? Excellent. Thank you so much.
Thank you.
Thank you, everyone.
Moving on to meetings held. Human Resource and Personnel Committee, Ms. Drew.
So I think everybody who ended up attending the meeting will agree that it was a very informative presentation, where Mr. Donahue presented what Human Resources is working on in regards to absences and actually getting the substitutes in, what some of the issues were with actually obtaining substitutes. He also discussed the future of the district in regards to retirements, potential leaves of absence, and also the incentives that they're working on to try to create and keep who we actually have and try to compete for new hires. So it was a very informative presentation, and I really appreciated it, so thank you.
Thank you, Ms. Drew. There's a meeting missing on the January 10th, 2022. We had the Wethersfield Early Childhood Collaborative, WEC, and Ms. Granato asked to report back to us.
Thank you. Well, WEC is Wethersfield's Early Childhood Collaborative, and we had a meeting on Monday, January 10th, as a Zoom meeting. The mission of WEC is that all Wethersfield children birth to 8 are healthy, developmentally successful learners and connected to the community. Each WEC meeting will now begin with a parent voice. This month's parent was Julie Bartuka, who spoke about the difficulties finding childcare during COVID. She also discussed her WEC baby bag, which gives lots of resources to new parents. Jermaine Nadeau is a WEC parent ambassador who was recently featured as a Wethersfield hero and now can be seen on the Wethersfield High School Eagle Eye. Marie Vasquez, another parent ambassador, has filmed a video for the Office of Early Childhood and will be featured on our state website. She's also shooting a parenting video with Yale University. The 6th class of UConn PEP Parent Leadership is now enrolling. Hold on, I gotta get to the next page. And the ESL Family Learning Program is now starting and is successfully enrolling English as second language residents. A great relationship has been built between the Wethersfield Public School K through 12 and adult education. So please view the WEC website for any and all information. And part of their mission is that a solid foundation of early childhood learning for parents and children is a must for a successful school system. Thank you.
Excellent, thank you, Ms. Granado. Finance and Operations Committee, 1/11/22, Ms. Drew.
So we had our meeting this evening, and we discussed year-to-date. We currently are at a deficit. However, that is being monitored, and that's pretty much a moving target, and it will change even for next month when we come. We also discussed the RFP for the transportation, and we hope that after a little bit of negotiation, we'll be able to bring the bids and the recommendation to the entire board shortly. We are also, it's budget season, yay! And so we have created some workshops. We will have our first workshop February 5th. The next one will be the 12th, and then we will also have one on February 15th. So I hope to see all of you there, enjoying discussing numbers.
Thank you, Ms. Drew. Meeting scheduled, Student Programs and Services on January 18th, 2022 at 6:30 PM. The CREC Council meeting on January 19th at 2022 at 11:30 AM. There is no unfinished business. Public comment. Anyone in the public wishing to make comment, please step to the podium, state your name and address, and you have 5 minutes. Seeing no public comment, moving on to board comment. Any board members wishing to make comment? Ms. Granado.
Okay, as the new year begins, the work of our Wethersfield Education Foundation continues. The foundation is an independent 501c3 organization that exists to support and enrich the goals, mission, vision, and strategic plan of the Wethersfield Public School. The 2022 fundraising campaign starts with this poster, and I even have a show and tell right here, that will be placed in Wethersfield businesses. This poster was created through the collaboration with our very capable and most helpful high-tech Wethersfield High School teacher, Joanne Campbell. I want to thank her for her guidance now and for her future work with the foundation. The poster will be placed in many area businesses to guide people to donate, to making a difference for our kids. The QR code enables residents and others to learn more about the Wethersfield Education Foundation and to easily contribute to this most important cause. I'd like to say thanks on behalf of the foundation for your donations now and in the future. Thank you.
Thank you. Any other board members? Mr. Cassio.
Thank you, Chuck. I just wanted to bring to the table and through Mike, Emmett, the rescheduling the Facilities and Maintenance Committee meeting that was did not take place. And do we want to poll the board with a next available date, or do we want to poll the heavy hitters first to see what their schedules are like?
Yeah, a good question, John. I have a meeting with Colliers on Thursday. It's a standing meeting, so I will check with them about availability. And in addition to that, I know over the course of the break, we had the geotechnical borings done, so I have reports that I will need to share, so I'll absolutely get on that.
Okay, good. And then did we want to bring that Facilities and Maintenance Committee again together once a month? Once we get through your Thursday meeting, so we have an idea of where we're going? So we'll look forward to that. Okay.
Thank you. Any other board members wishing to make comment? Yes, Dr. Regan Lefebvre.
17th, right?
Thank you very much. And thank you, John, for your last comment. I, too, am concerned about the Facilities Committee, just because I know we're all so excited to move ahead with potential changes to our campuses, and we need time to get moving on that. I'm not on that committee, but I really anticipate with a lot of excitement the work of that committee. And then I'd just like to echo my colleague, Mr. Riley. Michael Emmett, you said that you didn't want to push people to be vaccinated. Well, I do. I would like to push people to get vaccinated, not necessarily a mandate, but to encourage people in any way to get their children vaccinated. And I would love to chat with any members of the public and also my colleagues on the board about creative ways that we can incentivize and encourage vaccination, whether it is providing more information, providing actual pop-up clinics or something, providing some kind of I don't want to say reward, but something that would be appealing to families. I think we need to work as hard as we can to get those vaccination numbers up, because that's clearly what is between us and stopping the spread. And that's something that we all want, to keep our schools open, keep them safe. Thanks.
Thank you. Anyone else? Yes, Mr. Roberts.
Yes, I also am looking forward to having a maintenance and facilities meeting. I really
Say something.
am anxious to hear everything that's going on and what the plan is for the 10-year program also. So, and I am ready to help in whatever way I can if we come up with a plan to try to get the word out to really encourage parents with vaccinations. But the maintenance and facilities plan, that's really been on my mind, so I appreciate that.
Thank you.
We tentatively had a meeting scheduled for the 17th of January. So I'm wondering if, because it wasn't on the calendar, but we were going with, every third Monday. So I didn't know if we were going to postpone that one.
And that's Martin Luther King Day.
Yeah, so that's, okay. All right, sounds good. So we will resume meeting schedules in February.
Thank you. Anyone else? Yes, Mr. Riley.
I just wanted to mention that for some of these clinics for the younger ones, they're very creative. Some of the folks got dressed up for my daughter. They're dressed up for everybody. There was a dog there, so I think they're trying to do the best they can to incentivize folks coming out.
Thank you. Anyone else? Seeing none, do we have a motion to go into executive session?
So moved.
Do we have a second?
Second.
Any comments or discussions?
We need to cite who we're inviting into the meeting.
We never have, but we can if you want.
It's just a good idea to do.
We're going to have Mr. Donahue and Attorney McHale and Mr. Emmett.
I'll second that, if we haven't
Okay.
seconded it.
All in favor, say aye.
Aye.
Opposed? Abstention? Motion carries. Thank you, everyone.
I'm gonna